So what are the indications of IVF and when should you consider IVF as a treatment? Number one is the blocked or damaged fallopian tubes. That means those tubes which cannot be repaired, irreparable fallopian tubes. The second is severe male factor. When the sperm count is too low, then you have to consider IVF, especially if the sperm count is less than 5%, 5 million, 1 million, 2 million, motility is very less, very few sperms you have in hand, then you have to consider IVF. And also, if you have to take the sperm from the testis, that means there is agiospermia, there is no sperm outside, but you have to withdraw the sperm from the testis. That is called tese. Here also you have to go for IVF. The third is the severe endometriosis. Endometriosis is of various grades. So if the endometriosis is very severe, then you have to go for IVF. The fourth is the unexplained infertility. You have done all the investigation, nothing you find, and all the treatment has failed, and the patient is elderly, 35 years, you have to consider IVF. And fifth is whenever the women is considering the treatment of IVF for other reason, like she has a genetic disease and she doesn't want to transmit to her baby. So then she has to go for PGT, and for that you have to go for IVF. The sixth is that if the patient has a cancer and she has to go for the treatment if she has not completed the family, and before you have to go for cancer treatment, you can freeze your eggs or you can go for IVF to complete your family. Or in any case, fertility preservation is needed for any other purpose, like you don't want to go for IVF right now, but then you want to freeze your germ cells, you want to freeze your sperm, and you want to freeze your eggs because you have to go for cancer treatment, and that can affect your germ cell, and you are not still married and you have not found your partner, but you can definitely freeze your sperm or eggs. For that also you have to go for IVF. So these are the indications one has to consider. And the last but not the least, when everything has failed, you have tried IUI at least 4 attempts, and you have tried everything else, and you have no treatment options available, then you have to go for IVF. One more indication of IVF is premature ovarian failure. Because of any reason the woman is not making eggs, the eggs stores are depleted and you need egg donation, then she has to go for IVF. And also when she has to go for embryo donation, she has to go for IVF. And also whenever the third party reproduction like the surrogacy is needed, the patient has to go for IVF. So in spite of all the advancement, the IVF is not 100% successful. So what is the success rate of IVF? It is 30 to 50% per embryo transfer. So that means it is still low. Why it is low? Because the implantation doesn't happen with the every embryo we transfer. But when the couple goes for 3 cycles, almost 90% of the women, they conceive. So it is not less, and you have to compare with the 0%.